Hello, and welcome to our special session on the basics of Medicare. I'm Niki Trentacosta, your guide and expert at the Tanna Group. Whether you're nearing 65 or have already celebrated your birthday, understanding Medicare is crucial for your healthcare journey. Today, we're diving into the essentials of Medicare, breaking down its complexities to make your choices clearer and more manageable. Our journey today is not just about facts, it's about empowering you to make the best healthcare decisions for your future. Let's start with a little about us. The Tanna Group stands at the forefront of healthcare consulting with a focus on Medicare. Our journey began with a simple vision to demystify the complexities of health insurance. For over 15 years, we've been guiding individuals like you through the maze of healthcare. Our approach is personal, our expertise is deep, and our commitment is unwavering. We don't just offer advice, we build lasting relationships to support you at every step of your healthcare journey. What drives us at the Tanna Group? Two things. Our mission and our vision. Our vision is a world where healthcare decisions are clear, accessible, and empowering. We strive to turn the often confusing world of Medicare into a clear path for your health and well-being. Our mission is simple yet profound, to provide you with understandable, tailored healthcare options. We believe in encouraging you with knowledge and equipping you to make informed decisions about your Medicare coverage. Now, let's talk about Medicare. Medicare is a health insurance program run by the federal government. Specifically, the Department of Health and Human Services oversees the Centers for Medicare and Medicaid Services, or CMS. Oops, let me get my note pen going here. CMS. It's primarily for people aged 65 or older, but it's also available to younger individuals with certain disabilities and people with end-stage renal disease. Generally, if you're 65 or older, you qualify for Medicare. Now, enrollment timing is key. Your initial enrollment period begins 3 months before your 65th birthday and ends 3 months after your 65th birthday. Enrolling during this window is vital to avoid late penalties and ensure your coverage starts when you need it. Additionally, there are special enrollment periods based on many different scenarios throughout the year. Understanding Medicare can sometimes feel like you're learning a new language. So, to help us navigate our journey, let's clarify some key terms that we will often encounter. These 7 terms are essential to grasp as they form the foundation of your Medicare knowledge. We discussed enrollment eligibility on the last slide. Next is government or private. This refers to who manages the claims. Original Medicare Parts A and B are managed by the government, while Medicare Advantage, prescription drug plans, Medigap policies, these are all offered by private insurance companies that are regulated by CMS. Inpatient and outpatient describes the type of care you receive. Inpatient care involves an overnight stay in a hospital, while outpatient care includes services where you're not admitted to a hospital, like doctor's visits, scans, or same-day surgeries. The term network is essential for Medicare Advantage plans. A network is a list of doctors, hospitals, or other healthcare providers that your plan is contracted with to supply medical care. There's different types of networks, including HMO and PPO options available. Now, moving on to the financial part of these definitions, the deductible is how much you pay out of pocket before your healthcare starts to pay. It's a set figure that you need to meet each year. Coinsurance is the cost of any covered service. It's usually a percentage, and it kicks in after you've paid your deductible. Finally, the out-of-pocket maximum. This is the most you have to pay for any services in a plan year. Understanding these terms will help you better understand the specifics of your Medicare plan and help you make more informed decisions about your health care. Remember, the right knowledge is a powerful tool in managing your health and well-being. Now, let's begin our journey through the parts of Medicare. Let's begin with Medicare Part A, commonly known as hospital insurance. Part A is a fundamental part of Medicare, and it covers inpatient care. What does this mean for you? Well, if you need to stay in a hospital, skilled nursing facility, require hospice, or some home health services, Part A is there to help cover these costs. A key point to remember about Part A is for most people, it's premium free. If you or your spouse paid or worked in paid Medicare taxes for at least 10 years, you won't have to pay a monthly premium for this coverage. This is significant as it helps reduce your healthcare costs in retirement. However, there are some out-of-pocket costs that we need to be aware of. For instance, there's a $1,632 deductible for each hospital stay. You must understand that this is not an annual deductible, but rather it applies to each individual stay in the hospital. And while there's no coinsurance for the first 60 days of a hospital stay, extended stays will incur added costs. Now, the coverage under Part A is quite comprehensive for those inpatient services. However, it does not cover long-term or assisted living care, so consider planning accordingly. Part A is the base of your Medicare coverage. It's also the starting point for considering adding coverage options such as Medicare supplement plans, aka Medigap, or Medicare Advantage plans, aka Part C, which we'll discuss later. Second, let's explore Medicare Part B, also known as your medical insurance. This part covers your day-to-day healthcare needs. Part B is designed to help with the costs from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment, and some preventive services. Unlike Part A, most people pay a monthly premium for Part B through your Social Security account or wire transfer. The standard monthly premium for Part A is $174.70 per month, but this can vary based on your income level. This concept is known as the Income-Related Monthly Adjustment Amount, or IRMA. Simply described, if your income is higher, you might pay more for Part B. Another important aspect of Part B is the annual deductible, which is $240 per year. After you meet this deductible, Medicare pays 80% of approved services, and you're responsible for the remaining 20%. This 20% is known as your coinsurance, and it should be factored into your healthcare budgeting. Note here that there's no network associated with Part B. This means you can visit any doctor or healthcare provider in the United States that accepts Medicare. This offers a great deal of flexibility, allowing you to choose the providers that best meet your healthcare needs. Now, understanding Part B is key to effectively managing your outpatient medical expenses. While it covers a wide range of services, remember that it doesn't cover everything. Services like routine vision, dental care, hearing aids, and long-term care are not covered under Part B. It's essential to consider these limitations when you're planning your health care. Let's look at some options that meet some of these needs now. Medicare Part D, or prescription drug coverage, is essential for anyone who needs medication regularly. Unlike Parts A and B, Part D is offered through private insurance companies, and it's regulated by Medicare. Here's what we need to know about prescription drug coverage Part D. The costs for Part D plans vary. On average, the monthly premium is between $1 and $35 a month, but this can differ based on the plan you choose or your income level and geographic area. Remember, if your income's higher, you might pay more. But also, in Texas, I'm working with a plan right now that's only 50 cents a month, and it has great coverage for your Part D prescription plan. So let's keep that in mind. Now, each plan has its own set of deductibles and co-insurances, and that is going to vary depending on the medication you need and the specific plan that you select. Also, Part D plans also usually have preferred pharmacies, which means that you'll get the best rates on medications when you use these pharmacies. Now, be sure to check whether your preferred pharmacy is the same as the plan's preferred pharmacy before enrolling in your coverage. Also, there are limitations on how much you're subject to pay out of pocket for your medications. In 2024, the out-of-pocket maximum is $8,000. But thanks to the Inflation Reduction Act, in 2025, the annual out-of-pocket cost is going to be capped at $2,000 for anyone with Part D coverage. Finally, just like with other parts of Medicare, you have specific enrollment periods. It's important to enroll in a Part D plan when you first become eligible to avoid late enrollment periods. For example, if you don't sign up for Part D when you're first eligible and don't have other credible coverage, you could face a 1% penalty for each month that you were eligible but didn't enroll. This lasts your lifetime. Understanding Part D is pivotal for managing your medication costs. It's also, as always, we should review your Part D coverage annually, as your plans and medication needs can change, and you have the ability to update it at the beginning of each year. As we navigate further into Medicare, let's discuss Medicare supplement insurance, often known as Medigap. These plans are labeled as Parts E through N. Medigap plans are offered by private insurance companies and are available to anyone enrolled in Medicare Parts A and B. Here's a brief overview of what Medigap covers. Medigap plans pay for some of the healthcare costs that original Medicare doesn't cover, such as those co-payments, co-insurances, and deductibles. Unlike original Medicare, Medigap plans like original Medicare, these Medigap plans don't have a network. So just like your Part A and your Part B, you can use any doctor or hospital that accepts Medicare. The different plan letters, plans E through N, all offer varying levels of coverage that are standardized for all insurance providers and are regulated by the government. So each plan design is the same. If it's an E, they're all the same. If it's an F or a G, they're all the same. But the price may change between insurance carriers. Plan G is a popular choice as it offers comprehensive coverage, only leaving out the Part B deductible. Premiums for Medigap plans can range from $50 to $400 a month, depending on the plan and where you live. Currently in Texas, Medigap Plan G is ranging anywhere from $95 to $200 or $300 a month. So generally my clients are enrolling in $95 to $120 to $130. Now, the last part of Medicare that we'll be exploring today is Medicare Part C, also known as Medicare Advantage. This is an alternative to original Medicare and is offered by private insurance companies that are approved and subsidized by Medicare. Medicare Advantage plans bundle Part A and Part B, your medical and your hospital insurance, and often include your Part D prescription drug coverage as well. This makes it a convenient option and all-in-one choice. Many Medicare Advantage plans also offer extra benefits not covered under original Medicare or Medigap, such as vision, dental, hearing, and even some over-the-counter discounts. This can be a significant advantage if these are services you need or predict needing. One key thing to remember about Medicare Advantage plans is that they usually have a network of providers and hospitals. This means that you may need to see healthcare providers within the plan's network to get the lowest out-of-pocket costs. Now, it's vital to check whether your preferred doctors and hospitals are in the plan's network before you enroll in a Part C plan. While many Medicare Advantage plans offer $0 premium options, it's vital to look at some other costs like copays, deductibles, and out-of-pocket maximums. These costs can vary widely between plans. Also, you must be enrolled in Parts A and B in order to join a Medicare Advantage plan. All right. Now, you have made your decision and you are ready to move on with Medicare. Well, how do you know what's best? Right? Now that we've explored these distinct parts of Medicare, you can decide based off of your current medical factors. But what's important to know is that your answer is unique to everyone. As we transition into this next part of our presentation, we're going to focus on how to select the Medicare plan that aligns with your specific healthcare requirements, your lifestyle, and your financial situation, like we just discussed. Our goal is to equip you with the information necessary for you to make an informed decision. It's all about balancing costs, coverage, and convenience to find a plan that offers you peace of mind and meets your healthcare needs. Remember, there's no one-size-fits-all solution to Medicare. Now, let's delve into option 1 for your Medicare Choices, which is enrolling in Original Medicare. This means you enroll in your Part A hospital insurance, which is generally premium free. You have the $1,600 deductible and no co-insurance on the hospitals. Then you do your Part B, which covers your day-to-day medical needs. Most people pay the standard monthly premium of $174, and it comes with a $240 annual deductible. Also, you're going to pay that 20% coinsurance on all of your charges. Original Medicare supplies a broad range of coverage, but it doesn't cap out-of-pocket expenses. This is a major factor to consider, especially if you have frequent medical needs. In summary, Option 1, Original Medicare, offers a comprehensive hospital and medical coverage. It's a solid base in your healthcare needs in retirement, especially if you value flexibility and choice in your healthcare providers. Now, Option 2 is going to combine your Original Medicare with the prescription drug coverage, Part D. Now, let's break it down. So just like Option 1, you're going to enroll in your Part A and your Part B. But here's where the Option 2 differs. You then enroll in your Part D, which covers your prescription drug needs and is essential for those who need the regular medications. We're considering the cost of about $5 per month just to be on the generous side. So we're thinking our estimated expense is $174 plus $5, $180 a month at this point for our Medicare coverage. So to summarize, you're getting a suitable choice for those who need the regular medication and prefer the flexibility of Original Medicare. Now, let's explore Option 3, which combines the Original Medicare with a Medicare supplement, also known as the Medigap, and prescription drug coverage. So, this choice provides comprehensive approach to your healthcare coverage. As with the other options, you'll enroll in Part A, Part B, Part D, and here's where Option 3 stands out. You add on a Medigap policy, which is sold by the private insurance companies to help pay some of the costs that Original Medicare doesn't cover, like the co-payments and the co-insurance and the deductibles. Remember, the premium for the Medigap policy can range anywhere from $50 to $400 a month, but I'm quoting estimates around $100 to $120 a month. The range in premium is so wide because of the various levels of coverage. Now, the Plan G that we've discussed is the most popular choice for its comprehensive coverage. Now, Option 3 offers extensive coverage by combining your Original Medicare, your prescription drug coverage, and your supplemental insurance. It's an excellent choice for those who are seeking peace of mind and predictability in their healthcare expenses, because you won't have the copays to go along with it. Finally, let's discuss Option 4, which is Medicare Advantage, also known as Part C. This option offers the alternative to Original Medicare, and it's provided by private insurance companies that have been approved by Medicare. Now, I say alternative because what Advantage does is it takes that A and B and bundles it all together. Okay, so it's bundling your Part A, your Part B, and usually your Part D prescription drug, and doing all of the billing and administration for you. This means you get all of your Medicare coverage through one single plan. One of the major attractions of Medicare Advantage plans is that they often include benefits not covered by Original Medicare, such as dental, vision, and hearing. These extra benefits can supply significant value depending on your personal health needs. Many Medicare Advantage plans offer $0 monthly premiums. However, you will be subject to costs like co-payments, deductibles, and coinsurance. This choice is well suited for those who value having an all-in-one plan and are comfortable with a specific network of providers. It's also a desirable choice if you're interested in the other benefits that these plans can offer. So, you've made a Medicare choice, but what if your needs or preferences change? Let's discuss the flexibility and considerations of changing your Medicare plan. The good news is that Medicare offers an annual election period running from October 15th to December 7th each year. During this time, you can switch between Medicare Advantage and Original Medicare. You can also change Medicare Advantage plans, or you can add or drop Part D coverage. This period allows you to adjust your plan based on your changes in your healthcare needs or your financial situation. Now, here's a key note about Medigap policies. When you first enroll in a Medigap, or in your Part A and Part B, you have a Medigap open enrollment period, during which insurance companies can't deny you coverage or charge you more due to pre-existing conditions. However, if you initially choose a Medicare Advantage plan, which does not require medical questions, and later decide to switch back to Original Medicare with a Medigap policy, you will be subject to this Medicare medical underwriting. So it can change your premiums for that Medigap policy. Bingo right there. Now, we've covered a lot of ground, from understanding the distinct parts of Medicare to exploring the diverse options available to you. It's okay if you still have questions or feel uncertain about your choices. That is completely normal. Our goal is to ensure that you feel informed and confident in your healthcare decisions. Each of you have unique healthcare needs and circumstances, and we're here to provide personalized aid, whether it's helping you compare plans, understanding coverage details, or simply offering a listening ear to your concerns. As we come to the end of our journey through Medicare, I want to extend a heartfelt thank you for your time and attention today. Navigating Medicare can be complex, but remember, you're not alone in this journey. The Tanna Group is here to support and guide you every step of the way. Please feel free to contact us at the Tanna Group for any further help. You can visit our website, give us a call, or schedule a one-on-one consultation. We're here to help make the best Medicare choices for your lifestyle and health. Bye-bye.